Hi everyone, this is an overview of diabetes. By the end of this session, you should be able to define diabetes, know what hyperglycemia is, and what are its signs and symptoms. We'll review the process of what happened in our body when we eat food, and how that might change if we have diabetes. We will review the causes of diabetes as well as the types of diabetes. We'll point out the tests that we use to diagnose diabetes. We are going to highlight our target levels and what are the treatment options for diabetes. Hi everyone, my name is Haney Jarris. I'm a board certified clinical pharmacist and a diabetes care and education specialist. I'm here to present you with proven diabetes self-management and education support in order to empower you to best manage your diabetes through the knowledge and the skills that you may acquire here. The contents of my video are based on the framework of the Association of Diabetes Care and Education Specialists, as well as the American Diabetes Association. The link for both organizations, as well as any references that I'm going to mention in these sessions, are in the description box below. So what is diabetes? Diabetes presents as hyperglycemia. Well, another word, what is hyperglycemia? Hyperglycemia means high blood sugar. Hyper means high, glyce is glucose, and emia is blood. And high blood sugar and high blood glucose are exactly the same thing. They mean exactly the same thing. So where is the term diabetes mellitus came from then? Well, we know that diabetes goes back to the ancient Egyptian times. Diabetes is a Greek ancient word that means passing through or running through, referring to the patients with diabetes going to the bathroom a lot with frequent urination. And the term mellitus means sweet or honey. We had the ancient Japanese and Chinese scientists notice that dogs are drawn to the urine of some people. When that urine was analyzed, it was found to have some sugar material in it. So hence the term diabetes mellitus, referring to people who go to the bathroom a lot with frequent urination and the urine contains sugar. So is diabetes a sugar problem then? Many people think so, but actually it is not. Diabetes is not a sugar problem. Diabetes is insulin problem. Whether we don't have enough insulin in our body or the insulin that we have doesn't work properly, or both. To understand this process, let's just take a few minutes to talk about two important organs in our body that are very involved in regulating our blood sugar: the liver and the pancreas. As we see here, the pancreas sits right behind the stomach, right underneath the liver. And both the liver and the pancreas work together very close. The liver has about 500 functions in the body. Among these functions, it produces the bile that helps break down food in the intestine. It also produces or repackage certain fat to help carry out the fat throughout the body. And the liver also helps regulating our body level of amino acid that we use to build up muscles. And it stores extra sugar as a substance called glycogen, just in case we need it later in time of fasting or overnight. The pancreas has two important functions. The first function is secretion of the pancreatic juice. And that pancreatic juice helps us break down food into simple forms. And also the secretion of hormones that control how we use these simple forms as fuel for energy. These hormones include insulin. And insulin is made by the beta cells in the pancreas. And the beta cells in the pancreas constitute about only 1% of the pancreatic cells. Amylin is a hormone that produces by the alpha cells, and it actually helps the insulin works much better. Glucagon is also produced by the alpha cells of the pancreas, and it works to increase blood glucose, the opposite of the insulin. When we eat, food get broken down by the liver and the pancreatic juice into simple forms. Protein into amino acids, fat into fatty acids, carbohydrates into glucose. For the sake of our discussion today, let's just focus on the carbohydrates. When the carbohydrates get broken down into glucose, glucose is absorbed by the cell lining the intestine into the blood to be used as fuel for energy. But how is this going to happen? Well, the glucose will travel in the blood to the pancreas, and once it reaches the pancreas, the beta cells in the pancreas will detect how much glucose coming in, depends on how much sugar you eat, and it will produce a relevant amount of insulin. Both the insulin and glucose will travel all over the body to provide glucose as energy. So what happened at the cell sites? At the cell site, both glucose and insulin will exit the bloodstream. And on the cell, most of the cells that we have what we call insulin receptors. Insulin will bind with these receptors as a key and a lock. And once that happens, the insulin receptors will unlock certain signal which will allow passages and gates to open on the cell membrane that will allow glucose to go from the bloodstream into the cell to be used as energy. Let's just have a look at this process through this animation. As we can see here, once we eat carbohydrates get broken down into glucose in our intestine, and our intestine cell will absorb the glucose. Once in the blood, the glucose will travel until it gets to the pancreas. And in the pancreas, the beta cells will detect how much glucose we have, and then it will secrete insulin. Insulin and glucose will travel in the bloodstream until it gets to the tissue sites that it will need, like muscles or heart or kidney or brain. And at the tissue sites, the glucose and the insulin will exit the bloodstream. The insulin will bind with the insulin receptor, as we mentioned. When that happens, the insulin will open gates on the cell membranes, and then the glucose will enter the cell. Once inside the cell, the glucose will be used as fuel for energy. So what changes that happen to this process when we have diabetes then? Well, food get broken down by the liver and the pancreatic enzyme the same way. Glucose get absorbed by the intestines the same way. But the insulin, the key which will allow the glucose to go inside the cell, is missing, or we don't have enough quantity of it, or it is not working properly. It is not unlocking those receptors to allow the glucose to go inside the cell. And when the insulin is not driving the glucose from the blood inside the cell, the blood sugar started to go higher. And high blood sugar, the hyperglycemia, occurs. So diabetes is actually not a sugar problem, it's an insulin problem. Your cells are drowning in blood sugar from the outside, but they are actually starving for blood sugar from the inside. As we're going to review in a little bit, most common type of diabetes are type 1 and type 2 diabetes. Type 1 is an autoimmune disease where our body immune system turns against itself. And our immune system actually destructs the beta cells in the pancreas, thinking that they are foreign bodies. And when that happens, the beta cell cannot produce any more insulin. When you don't have insulin, you cannot drive glucose into the cell, and you have hyperglycemia. In type 2 diabetes, it's a little different. In type 2, the insulin receptors are not responding to the insulin. For some reason, when we see the insulin trying to bind to the insulin receptors, the receptors are deformed, and the insulin cannot unlock these receptors. And then when that happens, blood sugar cannot get inside the cell, and it starts to accumulate much higher outside the cell. Well, when you have so much blood sugar in the blood, it will send the signal to the pancreas and the beta cell, hey, we'll need more insulin. And the pancreas will produce more insulin to keep up with the demand. And the more insulin the pancreas is secreting is able to keep the blood sugar within range for years. But at some point, that beta cells start to get burned out and no more insulin is produced. And when that happens, you don't have insulin again driving glucose inside the cell, and blood sugar started to go higher. So in type 1 diabetes, insulin is missing because beta cell cannot produce any more insulin. And in type 2, the issues are the insulin receptors are not responding. So what are the type of diabetes? Well, we have so many type of diabetes, but the most common ones are prediabetes, which we used to call it borderline diabetes, type 1 diabetes or juvenile onset, or sometimes we call it insulin dependent diabetes, because people with type 1 need insulin to live. But sometimes people with type 2 will need also insulin at some point, but that doesn't mean that they have type 1. Type 1 diabetes usually diagnosed in the childhood, but up to 25 to 40% are also diagnosed in the adulthood. And sometimes that will create some confusion. But there are some tests like a C-peptide that can help determine what kind of diabetes you have. In type 2 diabetes, we call it insulin resistant diabetes or adult onset diabetes. Insulin resistant because initially start with the insulin receptors are not responding to the insulin, and when that happens, the pancreas start to ramp up the production of insulin trying to overcome that resistance, and it's able to drive the blood glucose into the cell and keep the blood sugar closer to normal for many, many years. But at some point, as we said, the beta cells cannot produce any more insulin, and that blood sugar starts to rise in the blood, and then type 2 diabetes occur. And we also have gestational diabetes, which usually happens sometimes in pregnancy. And up to 50% of the gestational diabetes cases go away after delivery. So what symptoms did you have before you found out that you have diabetes? Most of the diabetes symptoms are related to high blood sugar or our body effort to get rid of this sugar. Our kidney work as a filter. It filters out waste products from our body, including extra sugar. The more glucose in the blood, the more glucose will show up in the urine. Glucose leaving your body in the urine called glycosuria. Your body will need to make more urine in order to help get rid of this sugar, which lead to frequent urination. We also call that polyuria. When you urinate a lot, your body needs more water, so you feel thirsty. We'll call that polydipsia. So often getting up at night to go to the bathroom, it's very common in diabetes. And if you don't drink enough water, you will become dehydrated and your skin become dry, and dry skin cause itching. Also remember, your cells are starving for glucose from the inside, so you feel weak and you feel more hungrier. So dehydration, weakness, fatigue are also very common signs and symptoms of diabetes. Hyperglycemia and diabetes also cause blurred vision. Sugar accumulates in the lens of the eyes, causing the lens to swell and distort vision. As blood glucose returns to normal, the lens usually recovers its shape. And this is why it's recommended not to have an eye exams until after 6 to 7 weeks after your blood sugar goes back to normal range. Sign of symptoms of diabetes also delayed healing of the wound and increased number of some infections, especially vaginal and bladder infection. Sexual problems, tingling sensation are also very common symptoms that comes with diabetes. In type 1 diabetes, these symptoms comes on acutely. But in type 2 diabetes, people usually have these symptoms for years before they finally diagnosed with type 2. So how do we diagnose diabetes? Well, one method to diagnose diabetes called fasting blood glucose, where you fast for 8 hours and then blood sample is taken from your vein and the blood glucose is measured from this sample. Normal level is from 70 to 99 milligram per deciliter. Diabetes diagnosis is from 126 and above milligram per deciliter. Another method is called A1C. And the A1C level, 5.7 and below, this is normal level. For diabetes, 6.4 and above, it's usually diabetes. And sometimes if you have a random blood glucose level of more than 200, which is non-fasting, but with the sign of symptoms that we just described, frequent urination, very thirsty, very hungry, that could be a diagnosis for diabetes. When the diabetes diagnosis is not confirmed, we do sometimes what's called oral glucose tolerance test, where you fast from 8 to 12 hours and then a fasting blood glucose sample is taken, and then you'll take a load of 75 grams of glucose. And then your blood sugar is measured after 30 minutes or an hour after that for a couple of hours. And then if you have blood sugar more than 200 after 2 hours, this is usually a diagnosis of diabetes. How about the pre-diabetes diagnosis then? Well, fasting blood glucose from 100 to 125, it's considered pre-diabetes. If the A1C from 5.7 to 6.4, it is pre-diabetes as well too. So what causes diabetes then? Well, the exact causes of diabetes are not known, but we know that there are factors that can contribute to the development of diabetes. Genetics. Maybe in type 2 more than type 1. If you have a parent with type 1, chances of one of the children have type 1 is about 1 to 6%. But if we have a parent with type 2 diabetes, the chances of one of the children have type 2 is 10 to 15%. And of course, the risk goes higher if both parents have diabetes. Also, social determinant of health. The environment and the conditions where people born, live, learn, and work can affect their health and the risk of developing diabetes as well. Ethnicity and race. We know that Native American, Hispanic American, and Asian American have higher risk of developing diabetes. Hispanic American risk of developing diabetes is 50%, 1 in 2. Stress. Both emotional and physical stress can aggravate type 1 and type 2 diabetes. And of course, we know that overweight or obese is a huge factor. More than 80% of people are overweight or obese when they were diagnosed with type 2. So what are the treatment options of diabetes? How we treat diabetes? Well, before we dive into the treatment options of diabetes, I would like to review insulin resistance. And what are the causes for the insulin resistance? Because if we understand this, we'll understand the best way to manage diabetes, because simply, if we wanted to manage our diabetes and we treat it well, we want to reduce the insulin resistance. So in insulin resistant, the cell is not responsive to the insulin. It's not allowing glucose to come inside. And why? The exact mechanisms is not known. And researchers have been trying to answer these questions for decades. And there is multiple explanations out there. One explanation is maybe the cell is full of glucose and it cannot get any more glucose in. Well, maybe not, because there are researchers that were able to measure how much glucose inside the cells in people with diabetes, and they compare that to people without diabetes. And they found actually that blood glucose inside the cell in people with diabetes was much lower, not higher, than people without diabetes. Okay, one explanation is maybe the fat is the culprit. We know that gaining weight increases your risk of developing type 2 diabetes. We know that 80% of people with type 2 diabetes were obese or overweight at diagnosis. We know that losing weight helps improve insulin resistance. So it makes more sense that having extra fat is actually what's causing the insulin resistance. In one study, the researcher looked into a group of people and they were able to reduce that free fatty acids via medications overnight. And they measured the insulin sensitivity in the morning. And they found out that glucose inside the cell doubled. That means that lower free fatty acid means better insulin resistance. So another group of researchers, what they did is it actually infused more free fatty acid in some group of people. And what they found is insulin resistance increased, not only in the muscle cell, but also in the liver. So now we can definitely see a correlation. Higher free fatty acids mean more insulin resistant. Lower free fatty acid mean better insulin resistance. So maybe that free fatty acid could be the culprit. That whenever we have extra calories, the calorie get converted into fat and we store that fat in our fat tissues. But we have so many studies that tell us now that at some point we exceed the capacity of these fat tissues. And when that happens, the extra fat has to go somewhere. They go into the bloodstream and then they start to be stored in area where they're not supposed to be stored at, like the liver, the pancreas, and the muscles. The problem when this happens is they create so much inflammation around this area because they're not supposed to be there. We'll call that lipid toxicity. And then when that happens, they almost suffocate the pancreas and the liver. So we can definitely see the correlation between having extra fat and being overweight and insulin resistance. So in the diabetes prevention program that went on in the United States from 1999 to 2002, and they looked into 3,000 people with prediabetes trying to prevent diabetes from happening. And the researchers divide the group into two groups. One group, they assign a lifestyle change where during diet and physical exercise, the goal is to reduce weight by about 5 to 7%. And the other group of people, they assign them to Metformin, 850 milligram twice a day. And they follow these patients over 3 years. And what they found is in the group that they were assigned to a lifestyle modification, their chances of developing type 2 diabetes went down by 58%. And the group that they were assigned Metformin, their chances of developing type 2 diabetes went down by 30%. So, well, it's clearly weight loss is working, right? But when they dive deep into this group that they were assigned lifestyle change, even if they did not meet the weight loss target of the 5 to 7%, they still reduced the risk of diabetes by 44%. So that means it's not only the weight loss, it's also the physical activity. So now we have two things that we know right improve your insulin resistance: losing weight and exercising. And some of these people in the diabetes prevention program were followed up for 15 more years. And the risk of developing type 2 diabetes is still 50% in both groups. But something very interesting when we dive deep into that diet structure in the diabetes prevention program. They are initially introduced people to the idea of low fat. So initially, people were asked to eat less fat. And later on, the idea of low-calorie meal was introduced. So initially, low fat is very important. So in summary, in order to improve insulin resistance, we need to be active, we need to eat healthy. And then when we're talking about eating healthy, is very important to eat low fat. It's as important as eating low carb. And in future video, we'll talk about how reducing stress and getting enough sleep can also improve our insulin resistance. So that takes us to the treatment options for diabetes. Well, in type 1 diabetes, we know that you need insulin, but the insulin frequency and the doses will depend on your personal target, will depend on the exercise, will depend on your meals. For type 2 diabetes, treatment are done in stages. Usually the first and the most important thing, as we mentioned, is being active and eating healthy. And then if that doesn't work, there are oral medications, injectables, and insulin if needed. But each regimen you try should be reassessed every 3-6 months, and if it's not working, it should be changed. So now, what are the blood glucose targets for treatment? If you're a person with diabetes, your fasting blood glucose or the pre-meal blood glucose should be about 80 to 130. After meal, 2 hours after meal, should be below 180. And the A1C should be below 7. Again, these targets are general, and your targets could be different from one person to another. It depends on your circumstances and depends on your discussion with your physician. So that was a quick review about the definition of diabetes. But most important, what is your personal definition of diabetes? If you are a person with diabetes, what would you tell someone how living with diabetes is like? We know that caring for diabetes is different than caring for any other disease states. You, the person with diabetes, provide 95 to 99% of the care every single day. What to eat, how much you eat and when to eat, what medication you take and when, and the decision that you make today will affect how you feel today and your health in the future. Also, your team are experts on diabetes, but you are the expert on yourself. You know what best works for you. I also wanted to take a moment to acknowledge that it's okay to have strong feelings towards diabetes. Feeling of anger, why me? Feeling of frustration, not able to control diabetes and manage it. Feeling of guilt. All these feelings are diabetes-related stress, and they're quite normal. Diabetes is a complex condition, but it's treatable and it's manageable. And our goal from the treatment of diabetes should be to feel good now, today, and to prevent any health complications from happening in the future. Also need to know that most problems with diabetes are related to blood sugar being too high or too low. And the most important thing that you could do to manage your diabetes is to know about your diabetes and to know how to manage your blood sugar and keep it within range. And the best thing you could do now is to take a responsibility for a change and to pick up a personal target for yourself, for your blood glucose. And the closer that target to normal, the better. You don't have to make so many changes at once, but small change that's maintained, it's a good start. We talked about low-fat diet. We talked about low-carb diet. I will share options for low-fat and low-carb diet in the description below. Look at them and just decide on a small change. If you drink your coffee with 3 creamers, just make it 2 creamers or maybe 1 creamer. And we'll see how that will work out for you in the next couple of weeks, and come back and tell us, what did you do and how did you do it? And let's help each other out. See you next time.